Hi, I'm Dr. Russell Faust, Oakland County Health Division's Medical Director. I'm here today to provide a COVID-19 update. The state's COVID-19 vaccine dashboard reports nearly 800,000 Oakland County residents 12 years of age and over have been vaccinated with at least the first dose, and we are currently at 73.2% vaccination coverage who received at least their first dose. We're at a level of high transmission based on CDC's level of community transmission tracker. The 7-day case average in Oakland County was 255 new COVID-19 cases per day most recently. Now, late last week, following approval by the Food and Drug Administration, the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommended COVID-19 vaccine boosters for certain individuals who have received Pfizer-BioNTech's COVID-19 vaccine, at least 6 months or more after getting their second dose, can now receive a booster dose. I want to stress that the Pfizer vaccine is working. All COVID-19 vaccines are working very well to prevent severe illness, hospitalization, and death. However, experts are starting to see reduced protection against mild and moderate disease in some populations and higher risk settings. A booster dose can help further protect these people. Those who are uncertain about whether to get a vaccine or a booster or have questions should consult their physician. The following people should receive a booster of Pfizer vaccine: age 65 years and older, people age 50 to 64 with underlying medical conditions, residents 18 years and older in long-term care facilities. Other groups may receive a booster shot of Pfizer vaccine based on their individual risks and benefits. People aged 18 to 49 years with underlying medical conditions. People aged 18 to 64 years who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional setting. CDC lists these occupations at increased risk for COVID-19 exposure and transmission: first responders, healthcare workers, firefighters, police, congregate care staff, educational staff, teachers, support staff, daycare workers, food and agriculture workers, manufacturing workers, correction workers, U.S. Postal Service workers, public transit workers, and grocery store workers. Now, the risk of severe illness from COVID-19 increases with age, can also increase for adults of any age with underlying medical conditions. Because residents in long-term care settings live closely together in group settings and are often older adults with underlying medical conditions, they are at increased risk of infection and severe illness from COVID-19. Risk is highest for adults 65 and older, those aged 50 years and older who have underlying medical conditions, and people who live in long-term care settings. Adults aged 18 to 64 years who work or reside in certain settings, that is healthcare, schools, correctional facilities, homeless shelters, may also be at increased risk of being exposed to COVID-19, which could be spreading where they work or reside. We have now increased our number of community-based clinics to offer booster vaccines to those who are eligible, including an increased number of drive-through clinic opportunities. Pfizer booster doses are only available for those who are eligible. Appointments are encouraged, but walk-ins are still welcome. Visit our Get Vaccinated page for details. Those who do not have access to the internet may call Nurse on Call at 800-848-5533, Monday through Friday, 8:30 a.m. to 5 p.m. for more information. Thanks for joining us this week. As always, please continue to wear a mask in crowded settings. Wash your hands frequently to help prevent COVID-19. It's also essential for unvaccinated individuals aged 12 and up to consider starting their vaccine series to lower the risk of this disease in our community. One by one, our residents will get vaccinated. We're closer to ending this pandemic. Thanks for listening. Have a great week.